Have you ever taken a medication, trusting it would help you feel better, only to find yourself dealing with a new set of problems? Maybe it's a little dizziness, an upset stomach, or even something more concerning, like memory fog or fatigue. It's frustrating, isn't it? You're doing everything you're supposed to do, following your doctor's advice, taking your prescriptions on time. But instead of feeling better, you're left wondering if the cure is worse than the problem. If that sounds familiar, you're not alone. Many of us, especially as we get older, find ourselves taking more medications than ever before. And while these medications can be life-saving, they can also come with risks that aren't always fully explained. That's why today, we will talk about something that doesn't get enough attention: 5 common medications that might harm you, what doctors won't tell you. Now, before we dive in, let me be clear. This isn't about scaring you or telling you to stop taking your medications. That's not my place, and it's unsafe to do that without consulting your doctor. Instead, this is about empowering you with information. It's about helping you ask the right questions, have better conversations with your healthcare provider, and make informed decisions about your health. After all, knowledge is power, especially regarding your well-being. So, let's start with the first medication on our list: proton pump inhibitors, or PPIs. You might know them by brand names like Nexium, Prilosec, or Prevacid. These are commonly prescribed for acid reflux, heartburn, and GERD, conditions that many of us deal with as we age. And while they can be incredibly effective at reducing stomach acid, they're not without risks. One of the biggest concerns with long-term use of PPIs is their impact on bone health. Studies have shown that these medications can interfere with calcium absorption, which is crucial for maintaining strong bones. Over time, this can increase the risk of fractures, especially in older adults who are already more vulnerable to osteoporosis. But that's not all. PPIs have also been linked to vitamin B12 deficiency, which can lead to fatigue, memory problems, and even nerve damage. And if that weren't enough, there's growing evidence that long-term use of these medications may increase the risk of kidney disease. Now, I'm not saying you should stop taking your PPI if it's been prescribed to you. For many people, the benefits outweigh the risks, but it's worth having a conversation with your doctor about whether you really need to be on this medication long-term. Are there lifestyle changes you could make to manage your symptoms? Could you try a lower dose, or switch to a different type of medication? These are all questions worth exploring. If you're still here and learning something new, leave a comment below. I'd love to hear from you. If you're not subscribed yet, now's the time. Tap the bell so you don't miss out. Moving on, let's talk about another medication that's commonly prescribed but often comes with hidden risks: statins. If you're among the millions of people taking a statin to lower your cholesterol, you're probably familiar with the benefits. These medications can significantly reduce your risk of heart attack and stroke, which is why they're so widely prescribed. But like any medication, statins come with potential side effects. One of the most common complaints is muscle pain and weakness. For some people, this can be mild and manageable, but for others, it can be severe enough to interfere with daily activities. There's also some evidence that long-term use of statins may increase the risk of type 2 diabetes, particularly in older adults. And then there's the issue of memory and cognitive function. Some people report feeling foggy or forgetful while taking statins. And while the research on this is mixed, it's something to be aware of. Again, the key here is balance. Statins can be life-saving for many people, but they're not a one-size-fits-all solution. If you're experiencing side effects or are concerned about the long-term risks, talk to your doctor. There may be other ways to manage your cholesterol, like dietary changes or other types of medications, that could work better for you. Now, let's shift gears and talk about a medication that many of us have in our medicine cabinets: over-the-counter pain relievers, like ibuprofen and naproxen. These are often go-to solutions for aches and pains, and for good reason. They're effective, affordable, and easy to get. But just because they're available without a prescription doesn't mean they're risk-free. One of the biggest concerns with these medications is their impact on the stomach. Even short-term use can irritate the stomach lining, leading to discomfort, ulcers, or even bleeding. And if you're taking them regularly, the risks only increase. But it's not just your stomach that's at risk. Long-term use of NSAIDs, as they're called, has been linked to kidney damage, high blood pressure, and an increased risk of heart attack or stroke. And for older adults, who may already be dealing with these health issues, the risks are even greater. So, what's the alternative? Well, it depends on the type of pain you're dealing with. For some people, acetaminophen, like Tylenol, might be a safer option, though it's not without its own risks. For others, non-medication approaches, like physical therapy, heat or cold therapy, or even mindfulness techniques, might be worth exploring. The bottom line is this: when it comes to pain relief, it's important to think beyond the quick fix. Talk to your doctor about the best way to manage your pain, and don't be afraid to ask questions about the risks and benefits of any medication you're taking. If you're still here and learning something new, leave a comment below. I'd love to hear from you. If you're not subscribed yet, now's the time. Tap the bell so you don't miss out. Now that we've covered these first 3 medications, let's take a moment to reflect. The goal here isn't to make you anxious or second-guess your healthcare decisions. It's to give you the tools you need to take control of your health and make choices that are right for you. In the next part of this video, we'll dive into 2 more medications that might harm you. Medications that are often overlooked but can have a big impact on your health. So stay with me, because this is information you won't want to miss. But before we move on, I'd love to hear from you. Have you ever experienced side effects from any of these medications? Or have you found ways to manage your health without relying on them? Share your thoughts in the comments below. I read every single one and would love to hear your story. If you find this video helpful, please give it a thumbs up and subscribe to the channel. We're all about empowering you to live your healthiest, happiest life, and I'd love to have you as part of this community. All right, let's keep going. There's so much more to discuss, and I can't wait to share it with you. Now that we've talked about proton pump inhibitors, statins, and over-the-counter pain relievers, let's move on to 2 more medications that might affect your health in ways you don't expect. These are medications that many of us take without a second thought, but they can come with risks that aren't always discussed. First up, let's talk about sleeping pills. If you've ever struggled with insomnia, you know how frustrating it can be to lie awake night after night staring at the ceiling. It's no wonder so many people turn to medications like Ambien, Lunesta, or even over-the-counter options like diphenhydramine, the active ingredient in Benadryl and many sleep aids. These medications can help you fall asleep, but they're not a long-term solution, and they can come with some serious downsides. One of the biggest concerns with sleeping pills is their impact on your balance and coordination. As we get older, our risk of falls increases, and medications that make us drowsy can make that risk even higher. A fall might not sound like a big deal, but it can lead to broken bones, hospital stays, and a loss of independence for older adults. But it's not just your physical health that's at risk. Sleeping pills can also affect your memory and cognitive function. Some people report feeling groggy or foggy the next day, and there's even evidence that long-term use of these medications may increase the risk of dementia. And then there's the issue of dependency. Over time, your body can rely on sleeping pills to fall asleep, making it even harder to sleep without them. It's a vicious cycle that can be tough to break. So, what can you do if you're struggling with sleep? Well, the first step is to talk to your doctor. There may be underlying issues, like sleep apnea, anxiety, or even certain medications that are contributing to your insomnia. Addressing those issues might help you sleep better without relying on pills. In the meantime, there are plenty of natural strategies you can try. Establishing a regular sleep routine, avoiding caffeine and screens before bed, and creating a calm, comfortable sleep environment can all make a big difference. And if you're still having trouble, cognitive behavioral therapy for insomnia, CBTI, is a proven drug-free approach that's worth exploring. Now, let's move on to the 5th medication on our list: anticholinergic drugs. This broad category includes medications used to treat various conditions, from allergies and colds to overactive bladder and Parkinson's disease. You might recognize some of the brand names like Benadryl, Ditropan, or even certain antidepressants like amitriptyline. The problem with anticholinergic drugs is that they block a neurotransmitter called acetylcholine, which plays a key role in memory, learning, and muscle control. Over time, this can lead to cognitive decline and an increased risk of dementia. In fact, studies have shown that long-term use of these medications is associated with a higher risk of Alzheimer's disease and other forms of dementia. But that's not all. Anticholinergic drugs can also cause dry mouth, constipation, blurred vision, and difficulty urinating, side effects that can be particularly problematic for older adults. And because these medications are often prescribed for chronic conditions, many people end up taking them for years without realizing the potential risks. So, what can you do if you're taking an anticholinergic drug? The first step is to talk to your doctor. There may be alternative medications or treatments that are safer for you. For example, a non-sedating antihistamine might be a better option if you're taking an anticholinergic for allergies. If you're taking one for overactive bladder, behavioral therapies or other types of medications might work just as well. The key is to be proactive. Don't assume that a medication has been working for you just because it's the best option. Ask questions, do your research, and work with your doctor to find the safest, most effective treatment for your needs. If you're still here and learning something new, leave a comment below. I'd love to hear from you. If you're not subscribed yet, now's the time. Tap the bell so you don't miss out. Now, before we wrap up this part of the video, I want to take a moment to acknowledge something. Talking about the risks of medications can feel overwhelming, especially if you're taking multiple prescriptions. It's easy to feel like you're stuck between a rock and a hard place, trying to manage your health while also avoiding potential side effects. But here's the thing, you're not alone. Millions of people are navigating these same challenges, and there are steps you can take to protect your health. The most important thing is to stay informed, ask questions, and advocate for yourself. You deserve to feel your best, and that starts with understanding the medications you're taking and how they might be affecting you. In the next part of this video, we'll wrap up our discussion with some practical tips for managing your medications and reducing your risk of side effects. We'll also talk about how to have productive conversations with your doctor and what to do if you're concerned about your medication. But before we move on, I'd love to hear from you. Have you ever experienced side effects from sleeping pills or anticholinergic drugs? Or have you found ways to manage your health without relying on these medications? Share your thoughts in the comments below. I read every single one and would love to hear your story. If you find this video helpful, please give it a thumbs up and subscribe to the channel. We're all about empowering you to live your healthiest, happiest life, and I'd love to have you as part of this community. All right, let's keep going. There's so much more to discuss, and I can't wait to share it with you. We've covered a lot of ground in this video, haven't we? From proton pump inhibitors and statins to sleeping pills and anticholinergic drugs, we've explored some of the most common medications that might be harming you and what you can do about them. But before we wrap things up, I want to leave you with a few final thoughts and practical tips to help you take control of your health. First and foremost, let's talk about how to manage your medications effectively. If you're like many people, you might be taking multiple prescriptions, and keeping track of them all can feel overwhelming, but there are steps you can take to make it easier and safer. One of the simplest things you can do is create a medication list. Write down the name of each medication you're taking, the dosage, and what it's for. Keep this list in your wallet or on your phone, and make sure to update it whenever something changes. This can be incredibly helpful, not just for you, but for your doctor, pharmacist, or anyone else involved in your care. Another tip is to use a pill organizer. These little boxes with compartments for each day of the week can be a lifesaver in keeping track of your medications. They're especially helpful if you're taking multiple pills at different times of the day. And if you're tech-savvy, apps can even send you reminders to take your medications. But managing your medications isn't just about organization, it's also about communication. That brings me to my next point, how to have productive conversations with your doctor. Let's face it, doctor's appointments can feel rushed. You might have a lot to cover in a short time, and it's easy to forget to ask the most important questions. That's why it's so important to come prepared. Before your appointment, write down any questions or concerns you have about your medications. Are you experiencing side effects? Are there alternatives you could try? Could you lower your dose or stop taking a medication altogether? These are all questions worth asking. And don't be afraid to speak up. Your doctor is there to help you, but they can't read your mind. If something doesn't feel right, or if you're worried about a medication you're taking, say so. You have the right to be an active participant in your healthcare decisions. Now, let's talk about what to do if you're concerned about your medication. Maybe you've noticed some side effects or read something that's made you question whether a medication is right for you. Whatever the case, the first step is to talk to your doctor. But here's the thing, you don't have to wait for your next appointment. If you're concerned, call your doctor's office and ask to speak with them or a nurse. They can help you weigh the risks and benefits and decide whether a change is needed. Sometimes your doctor might suggest tapering off a medication rather than stopping it abruptly. This is especially important for medications like antidepressants or sleeping pills, which can cause withdrawal symptoms if stopped too quickly. And if you're ever in doubt, don't hesitate to get a second opinion. It's your health, and you deserve to feel confident in your decisions. Finally, I want to leave you with this. Small changes can make a big difference. You don't have to overhaul your entire medication regimen overnight. Start by having one conversation with your doctor. Try one natural remedy for sleep or pain. Make one small adjustment to your routine. Over time, these little changes can add up to a big impact on your health and well-being. Remember, you're not alone in this. Millions of people are navigating the same challenges, and there's a wealth of resources and support available to you. Whether it's talking to your doctor, joining a support group, or simply sharing your experiences with friends and family, there are people who care about you and want to help. So, as we wrap up this video, I want to thank you for being here. I know this is a lot of information to take in, but I hope it's given you some practical tools and a sense of empowerment. You deserve to feel your best, and I truly believe that you can get there with the right knowledge and support. If you're still here and learning something new, leave a comment below. I'd love to hear from you. If you're not subscribed yet, now's the time. Tap the bell so you don't miss out. Thanks for watching today's video. Take a moment to comment below with one takeaway and how you'll apply it in your own life. We really do read and appreciate every message. If you found this content useful, like, subscribe, and share it with someone who might benefit. Your support helps us keep showing up for you. See you next time.